Here's for a little bit now, and we're going to talk about the county budget, the revenues and expenses, the overall financial picture of the budget, and how that financial picture impacts our benefits. It's incumbent upon all of us, new employees, current employees, to utilize county resources as effectively as possible. If we see something that's inefficient, we should speak up and say, hey, is there a better way to do that? Sometimes it has to be done a certain way on this bottom level in order to fulfill a goal up here. But sometimes a process has, over years, morphed into something that it really wasn't supposed to be, and it's inefficient, but it's just over time has grown that way. So I would encourage you, if you see something that's inefficient, or you think you have a better idea on how it could be done, to speak up and let your supervisor know about that. Might not be anything that can be done about it, but it might be something that could really save some money. The county, just like in your personal life, you have a paycheck and you have your household expenses. The county has revenues and they have expenses. The county doesn't get a paycheck per se. We're funded largely by tax dollars. So ad valorem, or property tax, is the main source of county revenues. As a matter of fact, the county has about 83% of total revenues in its main budgeted funds are attributable to property tax. So you can see from 83% how very dependent the county is on its property taxes. And we're going to talk about that in a lot of detail. Ad valorem taxes were $43 million were budgeted in 2018, $44 million in 2019, and $47 million in 2020. We had this big jump from 44 to 47 because we added a special road and bridge tax in 2019 that was $1 million in 2019, and we bumped it up, the Commissioner's Court bumped it up to $2.8 million in 2020. So property tax is our main source of income. And then we have a lot of other revenue streams that total, over the last couple of years, about $8 million a year. That's a fairly stagnant source of revenue. It includes interest, fees and fines. If you go to the county clerk or your district clerk and you pay a fee, or you go to the JP and pay a fine, those are those kinds of things. If you are a new business and you want a beer or wine permit, that would be in this. If you need a marriage license. We also have a lot of grants. We have some grant folks here today, people whose salaries are funded by a new grant awarded by the state of Texas. And we have services to other entities. So, for instance, we have this luxurious facility known as a jail, and we sometimes host folks from other entities like the U.S. Marshal Service, sometimes from Shepherd Air Force Base. We also have a facility across the street for juveniles, and it's widely regarded throughout the state, and we get juveniles from other counties as well, and they pay Wichita County a fee for housing those. Now, we don't have a lot of space, unfortunately, in the juvenile area. It's usually full, and so, but when we do have space, there's generally a waiting list for people to come in and stay with us. Ad valorem taxes, or property taxes, have two components. There is the value of all the property. So if you're a homeowner, it's the value of your home. And then the Commissioner's Court set a rate. So you have the value and you have the rate. And the value times the rate is the revenue. In Wichita County, so if either of those things go up, either the valuation goes up or the rate goes up, you can make more money. And in our current economy, we are in a period of rising costs. So in order for the county even to stay even with our rising costs, we have to raise revenues. And the way to do it is to either have a valuation increase, and this is set by the appraisal district. We would either have a valuation increase, or the Commissioner's Court can increase the tax rate. You can see that over the last 5 years, there's not a whole lot of change in the valuation. 6.6, 6.5, 6.8, 6.8, and then we got lucky here in 2020, jumped up to $7.1 billion. So it's big numbers, but it's fairly constant. So in order for us to raise, generally speaking, the revenue that we need to match our increased expenses, the Commissioners Court have to raise the rate as well. Now this is very, very important. 2 reasons. First and foremost, the constitutional maximum. So in the state constitution is a maximum rate for property taxes, and that's 80 cents. So that's an important number to remember. 80 cents is the maximum that we can ever go to. Once we hit 80 cents, the Commissioners Court can no longer increase the rate because it's set by the Constitution. In 2020, we are at 67 cents right now. In 2016, we were at 55. So you can see that over the last 5 years, we've increased 12 cents. At 67, the difference between 67 and 80 is 13 cents. So if we were to go at the rate of spending that we've done over the last 5 years, we would reach that maximum in another 5 years. So in 2025, we would hit that max. And when we do that, we have to figure out how to cut costs, because we won't have the ability to raise the rate. If this number goes up, if the valuation goes up, that would generate a little bit more money. But it's going to be stuck at 80 cents on this factor, and this is the part that's always raised the majority of our increased revenues. Now, the state legislature, in all of its infinite wisdom, last legislative section, also put a caveat on this rate, and they said you can't raise the rate more than 3%, or it's subject to a rollback. That used to be 8%, and 8% generally covered what we needed to increase taxes for. 3% will not. Now we have, the Commissioners Court know that they have to be absolutely vigilant about raising the rate because we have so little margin to raise it. We're at 67, we can only go to 80. So they are really, really cognizant of those increased costs. But for instance, Corey talked about our health insurance costs increasing this year. The health insurance costs increasing is going to cost us over $400,000 a year. A 3% increase on our current taxes would give us a little less than $2 million. So if we take $440,000 off of that, now we have $1.5 million left. And on a $50+ million budget, that's not a whole lot of leeway. So we have to be really, really careful about our costs. This little chart shows it shows it a different way. It shows the valuation, the rate. This is the actual levy. This is how much revenue we hope to bring in, and this is the amount per penny. So for every extra penny, we raise about $700,000. So if our health insurance goes up 10% again next year, it'll be almost $500,000. And that would take a lot of any penny of increase. So we just have to be super, super careful. So as we're moving towards that 80 cents, I believe that the Commissioners Court will have no choice but to make some hard decisions regarding county budgets, county expenses in general, and county benefits. One of the things that, so salaries and benefits, what all of us, the county is a service organization, so salaries and benefits is our largest expense. The way to reduce those is to have less people or to have less benefits. The benefits that we have now, where the county pays 100% of our health insurance premium, is a very uncommon scenario. There's not very many employers out there that pay 100% of the employee's premium. So the commissioners, I'm talking strictly as Deborah Stevens, county auditor. This is not information from the commissioner's court. It's just what I believe could happen going forward. The commissioner's court could say any premium increases from now on will have to be passed to the employees because the county budget can't accept any more hits. Or we're going to be close to our 3% and we have to find some measure somewhere because we can't raise our expenses more than, our revenues more than 3% without a rollback. Or they could say we have to lower the premium, so we have to raise deductibles and raise our out-of-pocket costs. Linda talked about that earlier. We were able to reduce our premiums by implementing the HRA, but there's a limit to how much can be done in that area. So the Texas Association of Counties has maximum out-of-pockets, they have maximum deductibles, so we can only go up to those rates. And it costs money on the other side to reimburse employees for the HRA reimbursements. So those are some of the things that could happen. We have wonderful retirement. We have amazingly great retirement. It's a 2-to-1 match, and we earn 7%. The 7% is set by the state legislature, so that is statutory. The 2-to-1 is set by the commissioner's court. So if the commissioner's court thought, okay, we need to reduce our retirement costs, they could reduce that 2-to-1 to 1.9-to-1 or 1.5-to-1 or 1-to-1 or whatever they wanted to do. Now, all the money that everyone has earned up to that point would still get 2-to-1, but everything from whatever they decide to implement that forward would be matched at the lesser rate. So those are some kinds of things that could happen. But we have 3 programs in the county that are mandated by the state of Texas for which we get very, very little reimbursement from the state. That's the jail, indigent health care, and indigent defense. All 3 of those programs are very expensive to provide, but the county must provide it, and we get very little help from the state. Also in the Jail Standards Commission sets the standards for the jail. So when we were having one of these sessions, somebody said, well, we should just not do something for the inmates. Well, you can't do that because we have rules, and they're still human beings. They must be treated with dignity and respect and all that stuff. So it's not easy to simply cut expenses because you think we should be able to do that. There's all kinds of state rules that the county has to adhere to. Let's go to the next one. This is a chart that I made that shows kind of when we might hit that 80% maximum. And we kind of talked about it already if we keep going at the rate we're going. The good news is our historical rate in 2018, or into 2017, was 5.37% over the last 10 years. That's dropped slightly because we've been better at containing costs in our general fund, the biggest fund that we have, like the parent company. We've been better at conserving costs there. One of the big reasons was we saved $400,000 on health insurance. That's kind of a 1-2 year savings, and it's going to go back up now. But we were able to capture that, and that's a good savings that we had, and it kept expenses kind of flat. But even at 3%, we would still reach the max in 2026. So it was less than 3% last year, but nonetheless, that 80-cent maximum is coming down the pike before all that long. We talked about how the commissioners might plan ahead and talked about rethinking, benefits. Our retirement is over $3 million, just retirement contributions, over $3 million. Our health insurance is 4.2, probably going to go to 4.6 in 2020. Both of those things together is well over $7 million, and that's 11 cents of our tax rate. It's almost 12 cents now. So it's a big chunk of that 67 cents. 12 cents is just for health insurance and retirement. This just looks at it a slightly different way, and it shows that it takes 16%, that was in 2018, 16% of our entire tax revenues just to pay for health insurance, life insurance, and retirement. I'm going to turn it over to Corey now, and he's going to share with y'all some tips on how to plan ahead, give you some additional scenarios of what just we have come up with, brainstorming among ourselves, of some things that might happen because of these increased costs and reduced revenues.
All right. So first off, we're going to talk about planning ahead, which Deb's already tried to steal some of my thunder with talking about some of my information, but we'll continue with it anyways. So there are options available for the county, for the commissioners to make decisions in future years. Obviously, we already talked about that the county's still going to pay 100% of the employee-only portion this year. Linda's already talked about the HRA. So the county still kept everything the same going for 2020. However, going forward, and we see another 10% increase, most likely the county's not going to be able to engage a full 10% increase again. So they could have multiple options. They could freeze the rates at whatever they are at the time and say, going forward, the employees will burden any additional rates going forward. They could set it at a flat percentage rate and say, the county's going to pay X percentage of whatever the health insurance costs are, and the employees will cover the remaining. Like we said, Deb talked about increasing deductibles, increasing co-insurance, and increasing co-pays. When we did this a couple of years ago, when we first put in the HRA, we did a lot of that. We did a lot of increasing the deductibles, and the county took on a lot of the burden on the back end by buying back down those deductibles with the HRA. Since we're with the Texas Association of Counties, and Deb alluded to, they only offer so many plans. They only offer so many plans that have X number of deductibles and X number of co-insurance. We still have a little bit of room within those plans, but we don't have a lot of room in those plans, so even making additional changes like that, it would only buy maybe another year or two because there's just not very many options available. So at that point, the only way that the county could try to save any money on the back end is to reduce that HRA. So instead of the county buying back down to $700, they could move it to $1,000 or even greater and reduce some of that burden they have on the back end. There are a couple of other options that the Texas Association of Counties had talked about that the county could do to get back some of those premiums. And in the idea behind them is to try to get everybody at the county more healthy. So the more healthy everybody is at the county, obviously the less likely that we are to go to the doctor and incur all these expenses. So the Texas Association of Counties can assist the county in building in some additional parts of the plan, and what they are, I think one of them, what they talked about was a smoking cessation. So anybody that smokes would either be required to obviously quit smoking or take some kind of a smoking cessation program to try to quit smoking, and you do have to satisfy at least taking the class, and you would have 2020 to do. I mean, it's not in place. It probably won't even be next year, but possibly in 2021 you may have to take a smoking cessation program to avoid paying part of your premium. So if you don't do it, then you pay whatever the amount is that's picked. And the same thing for annual physicals. So they could require every employee to at least have an annual checkup every year. If you don't have it done within the year, the next year you would pay part of your premiums or X dollar of your premiums. And also as far as exercising and stuff like that, they could require you to sync your phone or get a pedometer or something to that nature and walk so many steps, so many days out of the year. And if you satisfy it, you don't incur any expenses. But if you don't satisfy it, then you could be burdened with part of your premiums as well. So some of the things that we can do to start containing costs is just, first off, understanding a little bit about your prescription coverage, matching your urgency of your condition, and going out and shopping around and finding all what's available as far as whenever you're having a procedure or having treatment done. So as far as prescriptions go, talk to your doctor. That's the first thing, because any kind of condition, whatever it is, most likely has multiple different types of prescriptions that are available. Some of them could be generic drugs, some of them can be brand name drugs, and some of them can be non-preferred brand name drugs. Generic is always the cheapest to you. It's always the cheapest to the plan. It's not always the best. I mean, we would prefer that if we can get a generic drug, but sometimes we have people go on there, they try out the generic drug, it doesn't work. If it doesn't work, go to the drug that works. We don't want anybody to put themselves in any kind of condition that would harm you. So always do what's best for yourself, but be aware. The Navitus does have a standard formulary. You can log into your Navitus site. It is also available on SharePoint as well. So you can go in there and look, say you're taking X prescription, or you know what your prescription is for whatever condition you are. You can go into that formulary and look at your prescription or look at your condition and see what's available and talk to your doctor about maybe trying something. Because you could see it'll be phased into 3 different types. There'll be a tier 1, a tier 2, and a tier 3. So if you go on there and your drug says it's a tier 3 drug, most likely you're paying a $50 copay every single month. But you could look at the one right above it, maybe a tier 1, and that tier 1 would be a $10 copay for you. So it would also be a lot less to the plan as well. GoodRx, you can go online to GoodRx or download the app. GoodRx will let you type in your prescription or your condition, and they'll tell you where price the pharmacies around the area. So if you're here in town, you're looking for a specific prescription, you type it in, they'll tell you how much it's going to be at Walmart, Target, CVS, Walgreens, so you can shop it around that way for yourself and for the plan. Also, talk to your doctor. You can ask your doctor for samples, especially on the really high-paying drugs. A lot of times, even a 5-day sample is a lot cheaper to you, and it could push off the expense a little bit on the plan as well. And a lot of those tier 3, those non-preferred brand name drugs, if you go onto their site, a lot of times they have discounts and coupons there as well. Sometimes you can get free samples or free month supply or something to that nature. But this little chart at the bottom just kind of shows you, we'll go over the very first one, the Novolog versus Lantus. Novolog and Lantus treat the exact same condition. They're pretty much, they're in the exact same category. The only difference is that and this is from GoodRx, Novolog is actually $600 for each prescription versus Lantus is a $300 prescription. And sometimes the difference in some of these is, like you can see the Cosentyx and the Soriatin. The Cosentyx is an injection, so it works a lot faster. The Soriatin is a pill, so it's a little bit slower getting into your system. Sometimes it may be the coating that's on the pill, so the coating may be something that lasts you all day long, so you only have to take it 1 time a day, and that makes it a brand name drug versus a generic drug won't have that exact same coating, so it might be something that you have to take 3 times a day. So that's mainly a lot of difference in some of those prices as far as being in the same classifications. So at the time that this was put together, there were 45 people that were on the Novolog that could have been eligible for the Lantus. So the 45 employees at $300 per prescription would have been $13,000 per prescription at that specific time. So those 45 could have saved $13,000 a month right there.
So you can see how that can really impact our overall costs. And when we impact our overall costs, it could be something as simple as that. It could be hundreds of thousands of dollars simply by us being better consumers. It might be that the other drug didn't work, but it might be that it could. So it's worth being educated and knowing what your options are.
You need to understand the options and match your urgency of your condition. So if you're just going in because you're sick and you have a cold, go to your regular urgent care doctor or your regular physician, because that's going to be the cheapest for you, because that's a $40 copay, and versus having to go to the emergency room where you're going to have a $300 copay plus additional testing, additional cost to the plan because the emergency room is going to be higher. Blue Cross Blue Shield does have a 24-hour nurse line, so if you're not feeling well and you're not sure whether it's a true emergency or whether you need to go to your doctor, you can call that nurse line. She can't prescribe you any medication or do anything like that, but she can tell you whether or not you probably need to go to the emergency room, or if it's something that you could find over the counter at Walmart that might satisfy you for a couple of days and help you prolong that, especially over the weekend or something of that nature when a lot of doctor's offices are not open. We talked about the MD Live. MD Live is available 24 hours a day, 7 days a week, so even if it's on the weekend, and that is only a $10 copay, so it's cheaper than getting out of the house at the same time, and you can use it even if the regular doctor's office is not open. Your primary doctor, health clinic, or urgent care clinics are your $40 copays, or if you go to a specialist, it's a $50 copay. We do have a PPO plan, so what that means is that you do not have to be referred to see a specialist. So if you go to your regular doctor and they say you need to have this MRI, they'll tell you where they want you to go to have the MRI. You don't necessarily have to go to who they tell you to. You have the option to go to anybody you want to, because we have a PPO plan. There's not a narrow network, so you can go to anybody. And we'll talk about how to do some of that stuff and look for places, because that can make a huge difference as far as cost. The hospital emergency room is always going to be the most expensive. It is a $300 copay, 80%. The plan covers 80% after that, but that's mainly for major injuries or life-threatening conditions. So if it is major and it is life-threatening, please do go to the emergency room. Don't put it off just because we told you to save some money. You can shop around. We presented this exact same scenario last year, but we keep it up there because it's such a good scenario to talk about. But a lady at Higginbotham was going to have an MRI, so she shopped it around to see the cost of the MRI. She first called the clinics of North Texas, and it was for that MRI was $393. Now that was just for the MRI, and that did not include any reading fees or radiology fees or any additional fees. That was just the MRI. The MRI center at the OSTC, $384, and it was completely, that was included everything, reading fees, everything. And the United Regional 11th Street campus, $986. So you can see right there just the difference from one side of town to the other side of town for basically the exact same MRI. Blue Cross Blue Shield does have a provider finder. You'll get your insurance card, you can log into your insurance and Blue Cross Blue Shield, and there will be a tab on there that you can click on, and it'll allow you to type in your condition, what kind of doctor you're looking for, search for different types of procedures, whatever you need to research, to look at, find in-network providers, you'll be able to access it from there. You can also do it by texting the BCBS TX to 33633 as well. But this is what it'll look like when you log into your Blue Cross Blue Shield. Across the top, it'll say doctors and hospitals. You'll click on doctors and hospitals, and there'll be a place right there to find a provider, and it'll bring up anybody that's in network in the area wherever you are. So you don't even have to be in Wichita County. You can be on vacation in Corpus Christi if you want to. And Linda talked earlier about your EOBs, your explanation of benefits. So if that comes in the mail and it gets misplaced and you can't remember what you got, where you deal with it, and you're ready to file your HRA, if you go into the claim center, you can view all your claims right there as well. One of the major expenses that we have with our health insurance plan is musculoskeletal. Kind of hard to say. Musculoskeletal is everything from head to toe, so I can see why it would be a pretty high expense. But pretty much anything that from head to toe is considered musculoskeletal. And the Texas Association of Counties is really big on the company Arosty. Arosty is an alternative to surgery and an effective hands-on treatment for issues. So if you have like a knee issue and you're having a hard time walking, you go to your doctor may tell you you need to have surgery or have something done to your knee. Arosty is going to want to try to go in there and figure out what the problem is, because they say a lot of times the problem is not necessarily the knee itself, it's the muscles and everything around the knee. So what they want to do is try to deep tissue, work the muscles and tissues around the area, and what it does is it reduces some of the swelling, but it pulls the muscle and tissue away from the actual knee itself, so it relieves some of that stress that's on there. And a lot of times they say it's effective, and they have like an 89% effective resolution rate, where you don't even have to come back. They want to try to get you in and see you in 3 visits or less and try to get you out the door, and they don't really want to see you again. So they're trying to completely heal you and not actually just treat you for forever and ever. When TAC first brought Arosty on board, they started bringing us to us to present. Arosty was not even covered under our health insurance plan. They were considered out of network. The next year, TAC was able to get them into in-network, so they were actually covered under in-network rates. Now they have them in there where they actually accept our copay, so it's a $40 copay and not just going over there and paying the full cost of the treatment. The closest one, though, however, at the moment is in Denton, so if you did decide you wanted to do Arosty, if you have one of those problems and you want to try Arosty, you will have to drive to Denton for your appointments. And I am going to turn it over to Linda now.
And I'm going to talk about Healthy County. So the Healthy County program is a part of the Texas Association of Counties Blue Cross Blue Shield, and it's designed to encourage employees to take steps to improve their health, because obviously healthier employees means lower cost to the health insurance plan, because they get sick less and they're healthier. So under Healthy County, there's several different sub-programs that you can do. The first one is the Healthy County portal. And we have wellness coordinators at Wichita County. They are Sherry Jones, who's the law librarian, and Sonia Labrie in HR. And they are actually in charge of the Healthy County program. So the Healthy County portal, they will actually send out emails a few times throughout the year and let you know of the different activities that you can be a part of if you're interested in it. All new employees are eligible to get a $30 credit towards a device. I think the first device that you can get is a $30 pedometer, so you don't have to pay anything. You wear that pedometer, you sync it with the Healthy County portal, and you can use it to achieve, I think there's 4 activities during the year. As long as you complete 3 of them during the year, you'll get a $50 gift card at the end of the year, typically to Amazon or something like that. But every year is a little bit different, and the activities are different. But they have wellness challenges, so sometimes, I believe the first one each year is you have to walk so many steps each day over a certain period of time, and it's actually pretty fun because you can, if you opt in, allow people to see how many steps you get, and then you can see what other people are doing. You can have little challenges within your office or with other offices on who's getting the most steps. And typically, the oldest employee at the county is the one who's getting the most steps. So it's like, holy cow, how's Willie doing that? But it's pretty neat. Also in the Healthy County portal, they have health education courses and tools that you can take advantage of, and I believe another activity they have throughout the year is encouraging you to track how much fruit and vegetables you eat and how much water you're drinking to, be healthier. Also under Healthy County, and this one is on the Blue Cross Blue Shield website. This is BCBS Well on Target. So to sign up for this one, you will go to your Blue Cross Blue Shield website, you'll log in and select the Well on Target. The device that you get with the Healthy County portal, you can use that also for the Well on Target program. And this one, you don't have to sign up for different activities during the year. You just sign up for the program, you have your device connected, and you get points for having your device connected and for just walking, or there's surveys you can take or little things you can read, and you get points towards that. Now this point thing, once you've accumulated enough points, you can use those points to buy things. Last year I got Apple AirPods and a KitchenAid mixer, and over the years I've got a Blu-ray DVD player and a Kindle. So those points really add up really quick. So for those of you who are watching on the live stream, if you're not already signed up, go ahead and go to your Blue Cross Blue Shield website and get signed up for the Well on Target, because you get 55 points a day just by being connected and having your device connected. So those points they add up pretty quick. It's kind of cool. Also through Healthy County is a tobacco cessation program. It's a voluntary program that if you're trying to quit using tobacco products, you can sign up for. They have counseling, online tools, and you can get discounts for products that'll help you stop using tobacco products. There's a Healthy Bite e-newsletter that you can sign up for. It's a monthly email that just gives you information on Healthy County news and upcoming program announcements. And then also part of the Healthy County is a Weight Watchers program that you can do at Wichita County. They have this currently they're having the meetings at JP11's courtroom, and Sherry Jones and Sonia Labrie send out the information for anyone who's interested in signing up. If you're interested, you fill out the form and you can pay for the program fees through payroll deduction. Now, the good thing about that is if you complete the program in entirety, at the end you can get $150 of the $152 or $156 program fees back in your pocket. So they'll reimburse you back $150 of that if you sign up through Weight Watchers in Healthy County and you complete the program. So it's very cool. They do that a few times throughout the year, and they'll send out an email and notification. So if you're interested in doing that, just watch for your email. And I think they're finishing up a program right now, so it might be a month or two before they get the next one going. All right, now I'm going to turn it over to Deborah Stevens again, Deb, for Blue 365 discount program information.
So in addition to all of the other things we've talked about, just because you have Blue Cross Blue Shield, if you sign up for this Blue 365 program at blue365deals.com, you can get more discounts. Because there's a lot of, Blue Cross Blue Shield deals with a lot of providers. And even independent providers that aren't really affiliated with anyone, sometimes they're affiliated with these kind of blanket organizations that sit on top up here, and they're members of that. So there's a lot of independent optometrists that are members of Davis Vision Group. And Davis Vision Group gives Blue Cross Blue Shield customers a discount. So anytime you go anywhere to a healthcare provider, always show them your Blue Cross Blue Shield card, even if you're not using it, because it might be that they will give you a discount just because you're a Blue Cross Blue Shield customer. The eyeglass place in the mall used to do that. I don't know if they still do. I haven't been in a couple of years. I need to go back again, but they used to give a discount just because you're a county employee that has Blue Cross Blue Shield insurance. So it's always worthwhile. Any healthcare provider that you go see, just try that and see if they'll take it. This program also issues every month or every week, they'll send you discounts on just different stuff. So one of my favorite examples, because it was so usable, was they sent you a coupon that got you some Oral-B toothbrush and Crest toothpaste. So it was a few bucks, but it's free and it's great. Also, they offered, over the years, they've offered discounts at these places, so you could go to Nutrisystem and get a big discount. They had a Skechers that was like $30 off, and a discount on a Lifetime Fitness membership program. So there's all kinds of stuff that they offer with all of the different firms that they promote and partner with. So it's worth it to sign up and just see if there's something that comes through your email that maybe you already use that you could save a little bit of money on. We've talked about the app already, and this app is Blue Access Mobile, and you can find it in the App Store under BSTX Blue. And this, we've already talked about it a lot, but it's a really cool app, and it gives you immediate information to all this stuff on your phone. So if you're traveling and you, as Corey might have mentioned earlier, and you have a health emergency, you need to find a network provider, you can just go to the app on your phone and find a network provider so that you don't get stuck with a giant bill because you had an emergency. It also will help you estimate the costs of the procedures like Corey talked about earlier of where's the best place to go in town. And you can, if you don't have your card with you, it can give you a temporary ID card that you can use at your doctor's office as well. You can also get the Centered app for iPhone, and that promotes wellness. So when you're having a really stressful day, you can whip out your iPhone, and depending on your level of stress, 1, 2, or 3 at the max, you can put your fingers together and listen to the app, slow your heartbeat, become one with the world, and reduce your stress. So it's a nice app to have as well. You can also sign up for Blue Cross Blue Shield text messaging, and that will send you a reminder to take your medicine. I use it in the morning to remind me to take my medicine. You can also, if you're so inclined, get weekly diet, exercise, and fitness tips. And you can also send a text message to Blue Cross Blue Shield if you want to find out some information about your account, and they will text you back. So it's a pretty cool thing. Again, all from your phone, and you could go to bcbstx.com mobile to get more information. Now we're going to switch gears again, and we're going to talk about optional benefits. Way back when the county was deciding on what benefits to pay for the employees, they said, we want to offer the best universal benefits that we can. So they picked life, health, and retirement. But then there was a need for a lot of people to have different products. So all of the stuff we're going to talk about now is available for you to purchase from a vendor through payroll deductions. These are all trusted vendors that the county has done business with for many, many years. They shop around and they shop prices for us so that you basically don't have to. These folks are all, we have local reps on all of them. Higginbotham Insurance handles a lot of these products for us in conjunction with Colonial, Superior Vision, and Kansas City Dental. All of these, Corey told you that you may or may not want to sign up for them this year because there's only going to be a month left for y'all. But there's no waiting periods after the coverage becomes effective. Now, they're not designed to replace insurance that you already have, but they supplement it. Linda's going to talk about cancer insurance, and it pays for some stuff that your regular insurance won't pay for. We have Colonial products that we're going to talk about. These are all portable. So if you were to leave county employment, all of those products you can take with you. The short-term disability, the cancer, the term life insurance, the universal life, those kinds of things. The dental and the vision would terminate when you terminate your employment. These premiums are paid 100% by the employees through payroll deductions. So once you sign up, we'll get the word, and then we will start deducting that amount from your paycheck every 2 weeks. You can also cover your dependents on any of these programs up until they're age 26. And then finally, Linda's going to talk to you about a 457B deferred compensation retirement plan. It's another retirement plan that is also tax sheltered if you choose, and it can help you save towards retirement in addition to what the county retirement plan does also. It has much more flexibility than the county's plan because it's a big conglomerate, for every county in Texas. And if you want to start saving small, it's an easy plan to have. I might also add here, along with the 457B plan, our current software will allow you to set up a savings account or any account at Post-Tel Credit Union. And if you want to have some of your money diverted to that savings account automatically through payroll deduction, we can do that for you too. We only have the option to do only one other extra account, so you can pick where you want your check to go on direct deposit. But if you want to set up a savings account at Post-Tel, we can also handle that for you. When we get new software in a couple of years, you'll be able to pick whatever accounts you want. But for now, we only have that one. There's two kinds of benefits. There's the pre-tax, like the flexible spending account that we talked about earlier, and those we pay the deductions before they're taxed. Others are after tax, and it depends on the way the money is distributed to you, if it's taxable to you when you get the benefit or not. Now, it's very important that you know that elections can only, so once you decide on all this stuff, and everyone listening on the live stream has heard this before, but once you sign up for your deductions or for your products, you can't change them. That's federal law unless you have a qualifying lifetime event, which are big life changes such as marriage, divorce, death, birth of or adoption of a child, that kind of thing. So inevitably every year there's a miscommunication between the enroller and the employee. The enrollers are only human, and they're going to see 500 people in a week. So they do their very best. You do your very best to be clear, but the employee's responsible for their deductions. So you're going to get a piece of paper from your enroller that's going to say, here's all the things that you want, that you said you wanted or didn't want. So maybe you're taking dental insurance this year and you don't want it next year. When they give you that piece of paper, you make sure that you look at every single item of information on it, and it is exactly what you want. Because once we send it off to the insurance company and the time limit goes by, you can't change it, and that's federal rules. And somebody gets stuck with that every year, despite all of our best efforts to make sure that everybody is reading their documents. So don't be the one that gets caught with not having the insurance that you need or having to pay a full year's premiums on something you decided you didn't want. So be sure to check that sheet of paper very, very carefully before you leave the room. I'm going to turn it over to Linda now, and she's going to talk about all the I'm going to keep talking about Colonial Benefits. I was so anxious to leave, sorry. I'm going to keep talking. These are the Colonial Benefits. You can see which ones are, these first two, the accident and the cancer, are pre-tax. So when you get your claim from on these plans, you won't have to pay any tax on it. All these are after tax. So you won't, I said that just opposite. These, since you're going to pay tax on the premium, you won't be taxed on them when you get the money. These you will. So these are the products that Colonial offers, and I'm going to talk about short-term disability. Linda's going to talk about accident, cancer, life insurance, critical illness, and then Corey's going to talk to you about dental and vision. But let's talk about short-term disability first. When we think of our biggest asset in our life, a lot of folks will think about what physical asset they have. Maybe it's your home, or maybe it's your stocks, or maybe it's your car, whatever is your asset you can touch. But really, what your biggest asset is your ability to produce revenue. For all of us that are working for Wichita County, that's our paycheck. So short-term disability helps to ensure your ability to earn an income and maintain your physical assets. An amazing fact here is that 33%, when I was doing research for this slide, 33% of all Americans will be disabled for at least 6 months during their lifetime. We all think we're kind of bulletproof and invisible, but we're not. And so you would just need to look at who you're responsible for and what kind of assets you have, liquid assets, that you could turn into cash if you were disabled. So if you have a family, you might have different set of needs than if you're a single person, living with your folks still. It depends on what your life situation is and how much reserves you have. And the premiums for this product are based on how long you can wait for the policy to kick in. So if you have currently, I have 2 months of living expenses in reserve, and I would just need to cover anything after that, that's going to be less expensive premium than if you want it to kick in 1 month, because obviously it kicks in sooner. It also is based on what your current income is. So if you currently make $30,000 a year, you can't get a policy for $100,000. It's on your current income only. Disability payments, they can be used for any life expense that you want. It is simply to replace the income if you're disabled. So you can use it for whatever you want. Now, caveat to that is, if you're cooking meth in your backyard and you blow yourself up, that is a felony, and it will not pay for a felonious injury activity. It also won't pay for pre-existing conditions during the first year the policy is in force. But after that, it would pay. It won't pay for a pregnancy within the first 9 months of the policy. And a pre-existing condition is basically anything you've ever been treated for. So just be careful on that. It also doesn't like it if you do illegal activities like we've talked about, or if you are a thrill seeker and you do one of these crazy things like flying or jumping out of airplanes or racing and those kind of things. So it won't pay for that. So if you want to go jump out of an airplane, you think, well, I better have some short-term disability, you better get some life insurance instead. It won't pay for suicide, and it won't pay if you go to war.
All right. I'm going to talk about accident coverage now. Accidents are, as you know, not something that you can plan for, but you can plan to be prepared if you have an accident and have out-of-pocket costs. These products that I'm going to talk about are not designed to replace your health insurance, but they're designed to fill the gap between what your health insurance pays and the out-of-pocket costs that you will have if you're faced with one of these. So the accident coverage will actually pay you directly. It will not pay your provider. It'll put money back in your pocket if you have an accident. The example that's on the accident flyer is of John, who was cleaning the gutters and he fell and he broke his leg. He had an ambulance ride. He had x-rays while he was there. He stayed in the hospital for a day. Then he had physical therapy. So it's very bad. Must have been really high gutters. But for every one of those things that he had done, he's going to get $200 for the ambulance, $125 for the emergency room, $30 for the x-ray. He'll get some for the hospital confinement. Leg fracture, he'll get $2,000 because he fractured his legs. Yeah, so it's based both on the severity of the injury. So if he didn't have a fracture, he probably wouldn't get that much. But also, Corey's making a face like, whoa. But also the different procedures that he has done is how the accident coverage pays out. I've told this story last year, but y'all haven't heard it. My husband broke his neck while he was riding a bike a couple years ago. He's good now. He was riding his bike in Arbuckle Mountains and went down a hill, and he broke his neck and multiple bones in his face. And complete accident because he was just up there having fun for the weekend, riding a bicycle, not a motorcycle, just a bicycle. So total accident, and thousands of dollars later, you know, he had to be care flighted to Oklahoma City, stayed in the hospital for several days, and it was like, oh my goodness, you don't plan for that sort of thing. And even if you have great insurance that we do here at the county, there is still a lot of out-of-pocket costs that you have if you're faced with a situation like that. So if you're someone who is accident prone, or your spouse is, or if you have kids that play sports, it might be something that you want. It's completely optional if you're interested in it. I did not mention this, but you will each get a rate sheet that has the rates on there if you're interested in any of these coverages. If you're listening on this live stream, the rate sheet was included in the PDF document that was sent out last Friday, and it's also available on the SharePoint. The next policy I'm going to talk about is the cancer insurance. Unfortunately, probably everyone in this room has been affected by cancer, either directly or by one of your close friends or family. Personally, in my family, I lost my mom to cancer, for breast cancer, 12 years ago. So it's pretty close to home for me. When we were doing the research for this one, I was surprised to see that for women, the odds are 1 in 3 will develop some type of cancer in their lifetime. And for men, the chance is 1 in 2. I was like, I mean, even though I know so many who've been affected by cancer, and even though I know, you know, I've lost so many that have been affected by cancer, that just seeing those stats was crazy to me. So again, this is not designed to cover health insurance. It's just designed to supplement it. Unfortunately, as you know, a lot of times when you are going through cancer treatment, you have to travel out of town. You might have to go down to MD Anderson, stay in a hotel, and you'll have out-of-pocket costs such as meal and gas. That's what the cancer insurance policy is designed for. It's designed to help you have some financial help during that difficult process and to help cover some of those costs. With this one, you will keep track of your expenses and you will submit it in a claim form to get reimbursed. So if you're interested in the cancer policy, that's one that you can select with your enroller when you sit down next week. Also through Colonial Life is life insurance. Earlier I mentioned that the county provides a life insurance policy equal to 1 time your annual salary. Now that policy is already in effect. You don't have to do anything to sign up for it. But if you're someone that you look at your personal situation and you're like, I need more than just one time my annual salary, here's a way to purchase additional life insurance through payroll deduction. They offer term or universal options. The term option is a short term, a set number of years, and you can get it for 10, 20, or 30 years. The term policy is typically a bit cheaper than the universal policy because after that term is up, you will have to reapply and your rates will go up because of your age, and they will take into account, your health and stuff. Now, the universal policy, if you get that, it's a permanent policy. So as long as you keep paying the rates, you keep paying the policy, your rates will remain the same for the rest of your life. So that's guaranteed rates for the rest of your life. You will not ever be canceled, and you can take these with you. So if you become an employee at Wichita County and you have one of these and you leave employment, you can continue to pay Colonial directly. You don't have to worry about losing your policy. The universal policy does build cash value. That's a benefit that the term policy does not. So if you're curious about how much life insurance you need, you can just look at your personal situation and see, do you have dependents that need your income? Do you have somebody that depends on you to provide shelter, car? Personally, I have a daughter that's going to college in next year. I used to be a few years, now it's next year. So if something were to happen to me, I still want her to be able to get through college. I still want to provide for them even if I'm not there anymore. So life insurance is a personal decision. You look at your personal situation and decide how much you might need to take care of your loved ones. Critical illness is a policy that covers heart attack, stroke, organ transplant, coma, blindness, hepatitis, bypass surgery, and end-stage renal failure. These are major critical illnesses, and it's limited to these. The way this policy works is if you have this policy and you're diagnosed with one of these, you will get the policy face value issued in a check to you that you can use however you need to. So if you need home modifications, or you have traveled or need rehab, you can use that money. Or if you need to use that money to cover your expenses while you're not working, you can use it that way. If you are in a situation where you unfortunately are diagnosed with more than one of these, you will get the policy, if you get two of these, you'll get it twice. So these are not things that you want to talk about or think about because there's sad situations. But if you find yourself in a situation like this, it's nice to have financial security. You have these policies to provide financial security if you're faced with this. So
if something runs in your family, if you have a genetic disposition to those, then you might be inclined to buy it. But, it's, again, as Linda said, it's a personal decision on all of this. We're just making you aware of the information.
Yeah. So just know it is available through payroll deduction if you're interested in this. And like Deb said, if you have a family history of it, you might be more likely to want to buy one of these policies. Also through Colonial Life, and this is through New Benefits, partnered with Colonial Life, is the Well Card. Now the neat one about this is it has 4 products rolled into one, and you get all 4 products. You don't have to choose one. The first one is Teladoc. So earlier Corey mentioned MD Live, and that's part of the Blue Cross Blue Shield. And as long as you have the county health insurance, you have access to Teladoc, which is telemedicine, that you can call a doctor, and it has a $10 copay. But it only covers the people that are covered under the health insurance. So if you have family members that are under another health insurance plan that don't have a telemedicine, you can buy the Well Card, and they can have access to telemedicine through the Teladoc. Now the good thing about this one is it has no copay. So with the MD Live, there's a $10 copay, which is still really, relatively cheap. But the Teladoc, if you get the Well Card, there's no copay to use the telemedicine this way. And if you get the family coverage, it will cover everyone in your family. So if you have 4 kids and a spouse that you want covered, you want to give them the telehealth option, you can get the family Well Card. Health advocacy, Corey mentioned earlier, shopping around. if you have the health advocacy and you don't want to take the time yourself to shop around, you can use the health advocacy to do that for you. They will actually shop around and find the cheapest rates for you. Or if you have questions about your bills and you don't want to call the insurance yourself, you want somebody to do that and explain it to you, they will do that for you. Safe Identity will send you alerts if you have accounts opened up in your name or there's a credit limit increase. It will just monitor your credit for you and send you alerts, so it's something that you might need to be aware of. Roadside assistance will bring you gas, help change your tire, or also covers towing if you have to get your vehicle towed. Now on that one, you pay out of pocket and then you submit a reimbursement and you can get reimbursed for that. So all of these are, you can get it for employee only or you can cover your entire family. Now the last one I'm going to talk about is the 457B Deferred Compensation Plan. Earlier I talked about TCDRS and the retirement that's provided, or that you have through the county. You're already enrolled, but this is an optional retirement plan if you want to save additional for later in life. So it's, the way this one works is we have two different companies that you can sign up with, Security Benefit or Nationwide. This one is not limited to signing up this week or next week with the enroller. You can sign up anytime during the year. And you can put money in either pre-tax or Roth, which is after-tax payroll deductions. You can contribute up to $19,000 annually or $25,000 if you're over 50. The IRS allows a catch-up if you want to put that much in, you have it. But you control how your account is invested. So on TCDRS actually has people that decide how the money is invested, and you get a guaranteed 7% interest on that one. With deferred compensation, you work with your retirement specialist to decide how your money is invested. So if you're older and you're getting closer to retirement and you just want to save some money pre-tax, you can just put it in there and not be risky with your investments. But if you're young and you decide, you know what, I've got a long way to go, I'm feeling a little bit riskier, you can go riskier with your investment. So you decide how your money's invested. The county does not have any say in that, and this one the county does not contribute anything to. So this is completely up to you. If you want to start an account, you can do so with as little as $5 per paycheck and then later increase it as you see fit. Or if you have an account and you need to pause your contributions for a while, you can do that too. So again, this one's not limited to open enrollment. You can make changes throughout the year. And now I think I'm going to turn it over to Corey to talk about dental and vision insurance.
The county also offers a dental insurance. It's through Kansas City Dental or 32 Dental, in case you're interested in dental products. The dental plan covers for preventive care, such as your routine exams, your cleanings and x-rays and stuff like that. The first year that you're on the plan covers 80%. The second year that you have the plan and going forward, it covers 100%. For basic coverages, such as your fillings and extractions, root canals, the plan covers 50% the first year, 65% the second year, and 80% the third year going forward. And there is a $50 deductible. The $50 deductible is for either basic or major. It's just one $50 deductible per year. It's not $50 for each one. The major services, such as your crowns and dentures and bridges and stuff like that, the plan covers 25% the first year, 35% the second year that you have the plan, and 50% going forward for every year that you have the plan. There is orthodontia built into the dental plan. However, the orthodontia is only for under age 19, so it would have to be a dependent child that was on your plan. The orthodontia does cover up to $375 per year with a $1,000 lifetime benefit. And there is also what they call a dependent care coverage built into the dental plan. So if you have your dependent, say you have your spouse or your children or whoever you have covered on your plan, and you were to suddenly pass away, they would be covered for a full year free of charge. And the rates are $31.98 for the employee only, and everything is split on a semi-monthly basis, so it'd be $15.99 per pay period coming out of your paycheck if you wanted the employee only coverage, or the $70.74 for the spouse coverage, and so on. There is also a vision plan. It's through Superior Vision. We talked earlier about The exam through your Blue Cross, your annual exam is covered as preventive care for free. This also covers your annual exam for a $10 copay. It can be used for either glasses or contacts, but not both in the same year. This plan, you can only use one time per calendar year. So if you got the plan and used it January 1st, you would not be able to use it again until the next January. Or if you get it in December and use it in December, you would not be able to use it until the following January of 2021. You wouldn't be able to, or following December of 2020. So you'd have to wait a full calendar year to use it again. Covers up to $130 for your frames. Covers your lenses in full. Now this is just in-network providers. If you go out of network, the pricing and coverages are a little bit different. Or if you utilize contacts, it covers up to $130 for on contact lenses as well. And the rates are there, employee only, $7.16 per month. So it's $358 semi-monthly. There are other great benefits for being a county employee and working for a government entity. There is such a thing as a federal public service loans, student loan forgiveness program. Now, if you work for the county for 10 years and you get student debt and it qualifies under the certain program fees, because they don't cover any kind of debt, they only cover certain kinds that are government loans. You make all your payments faithfully for 10 years and you don't have any back payments or missed payments or anything on that, have everything caught up, you do qualify to apply for a student loan forgiveness. Now, if you get approved, they would forgive the remainder of your debt on your student loans. However, it's a pretty difficult program to get approved for, and you have to also make sure that they are the right student loans. There are also discounts available at the.
A caveat to that is that it is a difficult to get reimbursed right now because they kind of halted the plan. But I would encourage everyone that has qualified student loans that they keep records of make all those payments on time and keep records, because you never can tell. A different administration might take a different look at student loan forgiveness, and then you would be set to submit the paperwork to qualify. So just keep track of it. It might be worth your while, might not. But getting your loan forgiven after 10 years is a pretty big deal. So
There are also other discounts available at the YMCA or the North Texas Rehabilitation Center. You can get a discounted rate for memberships at those gyms and places. You might have to show them a county or a paycheck stub or verify a county email address or something to that nature, but never hurts to ask. Major carriers like AT&T and Verizon sometimes give discounts on the main line for the county employee. Could be a 10 or 15% discount on the. You just have to ask them, let them know that you work for Wichita County, and however they want you to verify. Sam's Club, they're on site generally about once a month anymore. They're on site, and if you enroll or renew your membership while Sam's Club is on site, you can get quite a bit of discounts and different kinds of coupons and different things for savings from Sam's. Deb alluded to the Postal Credit Union. We do have Postal ATMs on site here and at the annex and the courthouse annex, so you can utilize those Postal ATMs, and you can set up a Postal account. A lot of employees have what they call a Christmas account. They set up a Postal savings account over there. They have so much money coming out of their paycheck that automatically directly goes into their savings account, and then in November they can withdraw that, and they have Christmas money to go shopping on. So they utilize it kind of like a savings account that way. It doesn't have to be that necessary way, but it is an option. And the Postal Credit Union can be completely different deduction from what your normal check is. So if you have your normal check set up to whichever Wells Fargo going over here on direct deposit, you can have X number of dollars going directly to your Postal that's separate, so you never see it until you actually go to your Postal and look. Enterprise will rent their cars to county employees at the county rate, so it's a substantially cheaper rate than what you would get if you just went up there and tried to rent a car on your own. So make sure that you tell them you're a county employee. Same with hotel reservations. Always ask and let them know you're a government employee, because you never know what kind of discounts and rates they have available just for government employees. And I'm going to turn it over to Ms. Stevens and let her talk about the enrollment process and finish us up.
So federal rules require that everyone go through open enrollment. That's not an auditor's office rule. It's not a commissioner's court rule. It's a federal rule. Everyone has to go through open enrollment because of the plans that we offer. So the enrollers will be here next week. We have an online enrollment process where you can sign up for an appointment with an enroller. So please, if you haven't already done that, do that and get that done. Again, make sure that you look at that piece of paper you're going to get in your open enrollment process and make sure every single piece of information is correct. If you're going to have dependents on your coverage, make sure you bring their social security numbers with you so that you can check that before you leave as well. If you need more information, if any of this is, you have a question about it, of course you can send us the question. You can call us and ask us the question. But we also have all of this information on the county SharePoint site. So if you go down and look on your Outlook and click on the, well, it's not on Outlook, it's on your internet, and then click on that, it'll open up the SharePoint. And then you can click on benefits, and it opens up all of this information. We have all the information from Colonial up here on the front counter. And if you want any more additional information on the Colonial products that Linda talked about, please feel free to pick that up, and there's a rate sheet here. If anybody that's watching wants any of that information, send us a note, and we'll be happy to send that to you in the interoffice mail. Again, it's a required process. Everyone has to come and either accept or decline any offer. The county doesn't care one bit if you get any of these optional products. The county doesn't make any money. We don't get any commissions. There's no benefit to the county. It's simply a service to the employees if it meets your needs. So don't feel any pressure whatsoever to buy any extra products unless you need and want them. Special arrangements have been made for the jail and the juvenile and any outlying offices, and they have separate schedules, and we've sent that to them. We've sent you an email, and so you could go use the link in the email to connect directly, and then you'll pick if you want to have your meeting at the courthouse here in this building, or if you want to be over at the Scott Street Annex. So just click on either one of those, and it'll take you and show you the available times that are still open to sign up. If you have any questions, please email us. Linda mentioned earlier not to email us certain stuff. That is your personal health insurance information. So because if you say, oh, I have diabetes and I have this question, that is an email that's then subject to Open Records Act. So that's what she was talking about, your personal kind of medical information. We're not HIPAA certified, so we shouldn't be seeing that information. But anything else, any questions that you have about your coverage or stuff like that, we are happy to answer those questions, and the best way to ask it is through email. But if you don't have email, you can certainly give us a call, and somebody will be able to call you back, or if not, talk to you right then. All right. Does anyone have any questions?
I just have one.
Yes.
So the number to call, if you have prior state time, like 18 years, would that do me any good to call that, even though I cashed out?
Yes,
Repeat
if
the
you have
question.
years of service with ERS, you can call TCDRS, which is their numbers on the back of this booklet, and just let them know those years of service, and they will give you credit for those years of service, because they can actually access those to see the years of service. I'm sorry, the question was, I didn't repeat the question. The question is, if an employee has retired from ERS, is it beneficial to,
State.
which is the state retirement system, to contact TCDRS and let them know those years of service? And yes, it is always beneficial if you have prior years of service with another retirement system in the state of Texas to let TCDRS know, because those years of service will get you closer to reaching your milestones of vesting and becoming retirement eligible.
And my city also, like cities.
Yes, City too, which is TMRS, Texas Municipal Retirement System.
If you were a prior county,
If you're a prior county employee, TCRS will already have those years of service on file for you, so you don't need to contact them about that. And if you've withdrawn your money or you've retired from TCRS from prior, they will still recognize your years of service. You just won't have that benefit of the funds that were in there.
Well, this is probably a crazy question, like with the state, your, vacation hours and stuff are done by your years of service. It won't be recognized by the county, right? Do you know what I'm trying to ask?
Yeah, there's no, the question is, do any vacation hour credits come along from state service? No, you start from zero when you begin with the county.
Okay.
Any other questions? All right, we thank you for your attendance today, and everybody will need to, Corey, you want to wrap up on what they need to do?
Yeah. So thank you if you're listening to the SharePoint. Have a good day.
We're going to talk to the new employees a little bit more.